Welcome to this episode of the Successful Encore Career Podcast. I'm Brett Johnson, longtime supporter of Employment for Seniors and producer of this podcast program. The Successful Encore Career Podcast program is presented by Employment for Seniors with support from the Central Ohio Area Agency on Aging, Nationwide Insurance, and InnoSource. Employment for Seniors will be hosting a hiring event on Thursday, December 6th with LifeCare Alliance. With me today is Barb Stoltz, Employment for Seniors Employer Outreach Associate. And on the phone, we have Molly Harrows, Director of the LifeCare Alliance Food Nutrition Program. Hi, Molly.
Hi. Thanks for having me.
You bet.
We're glad to have you, Molly. Let's start off with, why don't you share with us what LifeCare Alliance is all about?
Sure. So LifeCare Alliance is a not-for-profit agency here in Central Ohio. We serve 5 different counties in Central Ohio: Franklin, Madison, Champaign, Logan, and Marion counties with our Meals on Wheels program. And we're a pretty complex organization in that we have multiple services that fall under that umbrella. So Meals on Wheels is often the most familiar service that we offer, but we also have Help at Home, which is a homemaking program with light housekeeping and errand running and meal prep, as well as our wellness center, which is staffed by nurses and dietitians. We're able to provide in-home diabetic counseling with that. We have our Columbus Cancer Clinic, which provides low-cost to no-cost head-to-toe cancer screenings for the community at large, as well as cancer support services for people who are going through cancer treatment. So medical transportation, we have a food pantry, we have medication assistance, and also some access to prostheses. We also have our Project Open Hand Columbus program, which services people living with HIV/AIDS. And last, we have our Impact Safety program, which is a personal safety program which sims everywhere from feeling safe dealing with a conflict in the office to feeling safe walking to your car at night in the dark.
That is quite a range. That is really interesting. I hadn't realized that was all kinds of things that you had done.
That's not the first time we've heard that. Yeah,
okay.
For sure.
All right.
Sure.
Well, you mentioned some of the caregiver roles or other roles that are part of what you folks utilize people to do to help with your community outreach. Talk to us specifically about what kinds of job opportunities you are going to be seeking people for at your event here in December.
Well, it really spans the entire spectrum of the agency to some extent. I should also mention that we do have a catering company as well, which serves as sort of a for-profit entity of our agency, where the profits from that also go back in to support the agency. So it's not unusual for us to have openings with our catering team from a serving standpoint to even banquet captains. We have needs for home-delivered meal drivers, which could include driving your own vehicle to driving one of our cargo vehicles, where you'd be delivering either weekly frozen meals or daily hot meals. With our Help at Home program, we have what's called a direct care support worker, which is the person who does some of that light housekeeping, errands running, and then meal prep. Direct care support is where you help prepare meals or tailor family recipes so that they're a little bit healthier, or help with laying out a kitchen so it's safer for a person to move around. And then we do have the need for personal care assistance, which is some of the bathing assistance. And then lastly, along with our Meals on Wheels program, we have congregate dining sites that we call dining centers, and we are always looking for substitute dining center coordinators who help coordinate those meals at our different sites throughout the counties.
Now, are these mainly full-time or part-time roles? Are some seasonal? How do they figure into that?
No seasonal positions, but mixture of full-time as well as part-time. So, for instance, it can be as split down the middle as a Meals on Wheels driver can either be a part-time or a full-time. We try to be as flexible as we can with the needs of a person's schedule. And the same goes with our direct care support positions, where the vast majority of them are full-time positions, but if somebody's schedule dictates that that doesn't work for them, we can consider a part-time position as well.
Okay. Now, for some of these that you mentioned, like you said, there's quite a range. What kind of training is provided for people who are interested in that kind of an opportunity but just have not done it before?
From an agency-wide standpoint, we provide a lot of training around the confidentiality and HIPAA-related aspects of the fact that we are very involved in people's lives and to some extent their health statuses. So understanding working with confidentiality as well as populations that are in difficult positions, whether that's because of health reasons or economic reasons or lack of family support. So a lot of training around the sensitivity of the services that we provide, which touches on everything that we do, but also on a granular level, once the people get assigned to the program in which they'll be working, they get specific training on whether it's delivering Meals on Wheels, is being comfortable using a GPS, to following all of our funding guidelines because we get funding from so many different places. And then the same thing goes with our direct care support workers. We are able to train people to be STNAs, the homemakers. We do have that certification where we can provide that training. So if somebody does not currently have that designation, they are able to receive that training at our location.
You have a large geography area. Are you looking at bringing in people that you can work with their specific areas where they live to make it work for them as well?
Exactly. So with the positions open in Franklin County, it is pretty much countywide, so we can't guarantee anything in relation to where a person lives as far as the Franklin County is concerned. And with our other counties of Madison, Champaign, Logan, and Marion counties, the only program that is other than Meals on Wheels in the dining centers that's outside of Franklin County is Madison County, where we do have some direct care support needs in those. So the rest would be exclusively Meals on Wheels deliveries in those other counties. And yes, we're careful to be conscientious about where someone's located. So if someone were interested in delivering Meals on Wheels for us, but they live in Marion County, we have cargo drivers who deliver to those different counties each day. So the person wouldn't be expected to drive to Franklin County in order to make those deliveries in the outer county.
I thought that's probably the case. I wanted to narrow down all the opportunities that you were talking about, but also looking at it as, okay, it's really mostly concentrated Franklin County, which makes a big difference, in regards to, well, I might be a fit, but I can't do that in that county as well. So that's good to know how narrow the opportunities are, but narrow not in a negative. It's really mostly, all those opportunities, a lot of them will be mostly a Franklin County focus,
right,
but some outlying areas, which are good.
So, Molly, in terms of being interested in reaching out to our clients that are that 50-plus workforce, what appeals to LifeCare Alliance about that demographic that you think would make them a good fit for the opportunities that you have?
Well, I would say that, at least in my programs, the nutrition programs, it's the vast majority of our workforce. And what comes with that is maybe a good sense of sort of how the world works to some extent, because like I said, we are dealing with some challenging populations in that they're dealing with challenging situations themselves. So having had that experience, it's not unusual for people to come to us who have had supervisory experience earlier in their careers, and then maybe they're not looking for that level of intensity at this point, but yet they want to keep working. This is a good opportunity to still apply those skills that you learn as a supervisor, but with much less responsibility, but able to use those nuanced skills in different ways with our position. So that would be the home delivered meals. And then for many of our programs, I would say between 80 and 85% of the people that we're serving are older adults themselves, and you can't ignore the fact that having contact with a peer to some extent from our customer standpoint is refreshing and adds a layer of, I think, dignity to the service that can't be ignored.
What drew you to your organization? How long have you been there? What appeals to you about being a part of that?
I've been at LifeCare Alliance for 10 years, and prior to that I worked at a similar type agency in Chicago, but we relocated here. I really can't imagine working anywhere else, to be honest with you. So I would say the mission, obviously, is what gets you to the agency. You just think, wow, I could really make a difference every day. But what keeps me here and will probably always keep me here is just the extreme support that we give each other as coworkers, and the amount of support that we get from our leadership, and also the amount of respect we get in the community for the services that we're doing.
I think that's wonderful. I think you touched on a real important intangible benefit that often doesn't get shouted out enough in terms of that,
Yes.
Internal support and help and, the nurturing and potential career growth and whatever else it might be. So, okay.
Right. I mean, what we're doing is not easy work, and between not easy meaning that there's a lot to get done every day with sometimes not enough resources, but we're also dealing with, as I've said before, some challenging situations, and to feel that we're here for each other, I think, is probably one of the biggest motivators for a lot of us who are here.
Are there some tangible benefits that people might ordinarily expect or want that would be available in working for LifeCare Alliance?
The full-time employees have access to medical insurance. All employees are eligible for vision and dental, as well as the part-time and full-time with that. The other things that come with the agency are that all employees are able to work with our nurses and dietitians. We are all able to get head-to-toe cancer screenings. And we do have a digital mammography machine on site, and we have a nurse practitioner who also serves as a employee wellness support. So just if you're having a scratchy throat and you don't want to take the time off or head over to the urgent care, make an appointment with your doctor, you can go see our nurse practitioner here on site. And then some other benefits are that you get opportunity. This may not sound like a benefit, but to some extent you have easy access to volunteer opportunities. So sometimes people are looking for that. So if you're part of a community group or a church who is regularly looking for something to lend their time to, it's easy access to that for employees and as well as family members.
Okay.
Well, I think that's important. It's a social aspect that a lot of companies don't have. That's good. Oh.
Right.
So, Molly, where can people go to learn more about the different job opportunities you have available?
We regularly post some of our more frequently open positions, like the Meals on Wheels drivers and direct care support staff through our Help at Home program on our social media pages. But all openings are available under the LifeCareAlliance.org website, under the About tab, and join our team, and everything that's currently open is listed there. People can apply online through that, or if you'd rather do it in person, we're happy to provide an application to you here at our location as well.
That's terrific information. Well, we are inviting anyone who's interested to attend LifeCare Alliance's hiring event at the Employment for Seniors offices in Whitehall on Broad Street. It's on Thursday, December 6th. You are welcome to come anytime between 9:30 and 11:30. We would ask if you can register ahead of time by calling 614-863-1219. That way you'll be emailed some helpful information to help you prepare for the event. Otherwise, we look forward to having their recruiting team here on Thursday, December 6th. Thank you.
Okay, thanks, Molly.
Thank you so much.